like credit on your tax rebate and stuff like that.
Okay.
So, and
There's the medical piece and the financial piece. There also seems to be a social piece and a community piece that your organization in part addresses. Can you tell me about Hope Autism?
Sure. Hope Autism Services serves children and individuals affected by autism within Toronto region, as well as in Peel region, and they help again families find these resources, get connected to these financial services that are a requirement for the treatment and finding help for the autism affected families. So, and they would also provide you with therapy, like ABA therapy is one of the evidence-based practices that is proven to help in treatment of autism. I would want to stress this, there is no cure for autism at this point. Of course, the research is going on, but there is, of course, treatment available. Early intervention, the research shows, seems to have the most effect on these individuals. If these individuals start getting help by the age of 2 or 3, their chances of getting improvement and treatment help increases substantially. So our organization, Hope Autism, would get you connected to these screening tools, these diagnosis help and all that very quickly, so you can get the treatment online very quickly.
If there is no cure, or no cure yet, because we like to think that the research dollars will go towards that.
Right.
How can the quality of life be improved for, let's say, a child living with autism and, as a result, their family?
With autism, you would definitely, the 3 core main areas that I've talked about, that you find that impairments in language, communication, that's a biggie in there. When the frustration usually arises, all the behavioral issues that you see in these children arises due to these communication trouble when they're not able to explain what they want. So so there's treatment, something called ABA, Applied Behavior Analysis Treatment Therapy, which would teach these kids how to communicate properly so they can lead on to independent life later on. Of course, not 100%, but the chances of them independently living on their own and being part of the society independently would increase substantially by 70 to 80%. They will be able to communicate, like social interaction impairments that I talked about. AB again can step in and would be able to help you do those eye contact, those initiations of social interaction, how to talk about your emotions and stuff like that. And again, those stereotypical behaviors like repetitive behaviors that you get to see in autism, again, that can be modified, or they can be found a replacement through this therapy for you.
And you've seen in a quantifiable way the improvement already?
Oh yes, I've been in this field for more than almost 7 years now, and I've personally worked with these children and families, and the difference that you would see from when we get them by the age of 3, and it goes up substantially. That I have some kids I've worked with them since they were 3 years old. Now they're 10, and they're independently going to school. They've transitioned into mainstream schools. They have friends, they have family, and they actually are in a relationship. They do exactly what typical children do.
That must be very rewarding for you as well.
Yes, that is one part of being in the field, that when you get to see these gains within these kids, that's the most rewarding part.
Well, thank you so much for telling us about it, and I want again to direct folks to the right place if they are in fact living with somebody who suffers from autism. Go to the Ministry of Child Services?
Child and Youth Services.
Child and Youth Services. And in the meantime, please visit www.hopeautism.ca. Thank you so much for coming on the show, and it's lovely to meet you. There's much more coming up on Daytime. Don't go away. We'll be right after this.